A Saskatoon pharmacist and professor, who is also a member of Yellow Quill First Nation, has spent a lot of time looking to why other Indigenous people might be hesitant to get vaccinated for COVID-19. Last month, the Canadian Medical Association Journal published Jairus Swidrovich's research results. He joins us now just after receiving his first dose of vaccine. How was it?
Hello. It was really quite exciting and honestly quite an emotional time.
What made you want to look into vaccine hesitancy, and what was the one thing that really stood out in your research?
Sure. I was first approached by Dr. Ian Mosby, who's a history professor out at Ryerson University in Toronto, and it was his research that illuminated the experimentations done on children in the residential schools. Like nutritional experiments, and then also previous experiments that were done, like the tuberculosis vaccine on Indigenous peoples in Canada, and even some more recent and current controversies like forced and coerced sterilization of Indigenous women. Thinking about all of these historical and even current policies and practices, Dr. Mosby and I wanted to join forces. That was the first time I, as a pharmacist, collaborated with the historian, which was really cool. And we wanted to bring to light just all of the reasons, well, maybe not all of the reasons, but a number of the really good reasons why Indigenous peoples might be hesitant to receive the vaccine. And in terms of what stood out, really, it's just been some really stark examples of mistreatment. For example, in our previous pandemic, the H1N1, for example, a community in Manitoba received body bags from the federal government instead of supplies like hand sanitizers and masks and cleaning equipment. And then even looking at the forced and coerced sterilization of Indigenous women that perhaps is even ongoing across Canada, but we have heard confirmation of this very recently.
Wow. Tell me about the important distinction between vaccine hesitancy and vaccine refusal.
In some ways, I almost think of that as like crossing the street. Some people would want to hesitate before they cross the street. Some people might just go for it, but that probably isn't the safest way. Vaccine hesitancy is taking a moment really just to think everything through. Perhaps some people will gather evidence from their elders or advice from their elders or people in their community, family members, friends, or health professionals who they know and trust. And then refusal would be just exactly as what the word implies of saying, no, I'm not going to get the vaccine.
What recommendations do you have to ensure Indigenous people are protected from COVID-19, both on and off reserve?
So I would recommend to follow all public health advice that's given to us both provincially and federally too. I know that each community, for people who live on reserve or in a smaller community, each community has their own regulations, which is really awesome. I'm happy to see communities take ownership in that regard. Sometimes those limitations are, don't leave or don't come into the community during a certain period of time, and so that would be important to protect yourself, your community members, your elders, our life givers, so people who are pregnant, for example, and then just continuing to follow all public health advice and keeping your distance between folks and wearing a mask and hand sanitizing and washing your hands with soap and water.
Jairus, thanks so much for your time and congrats on the vaccine.
Thank you so much.
Jairus Swidrovich is a member of the Yellow Quill First Nation. He is also a pharmacist in Saskatoon and an assistant professor at the University of Saskatchewan College of Pharmacy and Nutrition.